Welcome to our show, Expert Speak. Today we have with us Dr. Deepa Jayaram. She is a renowned consultant in nephrology and transplantology. Today she will talk to us about common ailments of the kidney and associated illnesses. Doctor, a number of people donate their kidney. What are the lifestyle changes for a person living with one kidney, and what are the possible complications of having only one kidney?
So when a patient reaches kidney failure or end-stage kidney disease, and the nephrologist gives them the option of either remaining on dialysis, either hemodialysis or peritoneal dialysis lifelong, versus kidney transplantation, the preferred option is always a kidney transplantation. The reason being, a kidney transplantation procedure will offer a substantial improvement in the mortality of the patient. So when you look at different studies, if you compare the survival of patients who remain on dialysis versus a patient who has received a kidney transplant, the patient who has had a kidney transplant that is working well has a substantial survival advantage over a patient being on dialysis. So this should be a preferred modality of treatment of kidney failure for all of our patients. In addition, the quality of life that you get after you get a new kidney is something which dialysis cannot offer to the patients, because even though we are doing very good in terms of removing most of the waste materials by this artificial technique called dialysis, it cannot completely take over the function of a healthy kidney. So in that sense, the quality of life that a patient gets is phenomenal, and that is why kidney transplant should be the preferred option. However, this is something which not everybody is able to get, and not everybody is able to be considered as candidates either. For example, if you have some underlying cardiac problem which has not been corrected, then automatically you will not be able to receive a kidney transplantation, because your risk of dying from a cardiac problem is very high after the transplant. Secondly, if you have some underlying severe infection or an underlying malignancy, those patients also have an absolute contraindication in terms of receiving a kidney transplant. So other than these, most of the other patients can be considered for receiving a kidney transplantation. In terms of kidney transplants, there are two types of kidney transplants. One is a deceased donor kidney transplant, where the transplant organ or the kidney is removed from a patient who is being diagnosed with brain death. The other is a living donor kidney transplant, where one of the patient's close family member or a friend wishes to donate a kidney to the patient, and if the patient is found to be a suitable candidate to be a donor, then the transplantation surgery is taken up. Now, to give you a very brief idea about kidney transplantation procedure, I will first talk about the living donor transplants. So usually the scenario is a patient who has been diagnosed with kidney failure is told to start dialysis, and he has a he has a family member who is very keen on donating, and in India the immediate family members like the parents, brothers, sisters, husband, wife, grandparents, siblings, they can easily donate a kidney to their loved ones. Whereas if it is from any other distant relative or any other friend, then the approval has to come from the state appropriate authorizing committee. So if supposing a person wishes to donate a kidney to his or her family member, the first thing that we do is check the blood group, because if the blood group is compatible, that's the first thing, and this is the same as your routine blood cross matching. If that means a person who is blood group O can donate a kidney to a person who is blood group B, because they will not react there, or a person who is blood group B can easily donate to another recipient who is blood group B. In addition, the other test which is done is something called tissue matching. Tissue matching is a test where we look at, we take the blood from the potential donor and the potential recipient, and tests are carried out to see if the recipient who is going to receive the kidney is reacting to the donor's blood cells. So this is called a cross match procedure, and if it comes back positive, that means you probably should not go ahead with the transplantation, because already there is some kind of reactivity between the donor and the recipient. So if you have a positive cross match, then you do not take up that pair for transplantation. But if your blood groups are compatible and if you have a negative cross match, then you can go ahead with further testing. Now, generally when you're doing a donor evaluation of any living person who wishes to donate, it is a complete history, physical and surgical examination, because only the very healthy and the fit persons are allowed to donate, which means the patient should not have any underlying medical condition like diabetes or high blood pressure or any other condition which could jeopardize his kidney function in the future. So we screen the donor through intense rigorous testing, and only when all of that is negative, then we allow those potential candidates to go ahead for donation. Why? The reason is simple, because the number one priority is to ensure that no harm comes to the donor as a result of kidney donation. So to make it safe for the donor, a lot of screening procedures are done to make sure that the donor is in absolute good health physically as well as mentally, so as to donate. So in terms of what is the life of the person after he donates a kidney, so once the person donates a kidney, there are certain immediate risk factors or immediate complications which can occur, which is mainly due to the surrounding surgical procedure. There may be an infection, there could be some surgery related wound issues, etc. But this is just like any other major surgical complication. But what is more important is, are there any long-term adverse effects to a patient as a result of donating a kidney? And there have been multiple studies which have shown that in the long run, the donor survival as well as donor kidney function have been found to be excellent, and it is no different from a similar age match control from the general population. So to put it in layman's term, kidney donation for the donor is absolutely safe. One of the main reasons being, we actually screen these people so well to make sure that only the fittest of the fit persons are allowed to donate a kidney. Okay. In addition, the donor after donating the kidney should just maintain and follow the usual healthful practices, in the sense, make sure you are taking adequate fluids, do your routine annual physical examination, avoid excessive over the counter pain pills or any indiscreet use of antibiotics, etc.